Good afternoon, everyone. We are doing a program snapshot this afternoon, which is talking with practitioners around their program and practice approach when working with adolescents who use violence in the home. I'll just start by acknowledging traditional owners on the land where we're meeting today, wherever that may be, and pay respects to elders past, present and emerging, and any Aboriginal colleagues who are listening into the conversation today. My name is Carolyn Davies and I'm a project officer at the Centre for Excellence, and I'm joined by my colleague Emma Nugent, who I will now pass over to introduce today's guest.
Of course. Today we're speaking with Scarlett from Baptcare about the Adolescent Family Violence Program and how they utilise a whole-of-family approach. Thank you for speaking with us today, Scarlett. To get started, could you please tell us a bit about the background of this program?
Absolutely. Thanks for having me. Like many of the adolescent family violence programs, we're one of the recommendations out of the Royal Commission, recommendation 123, to roll out adolescent family violence programs across Victoria. It's a really exciting opportunity, and within that we're following a therapeutic case management approach to work with adolescents and their families. In using that, we're trying to draw on a multitude of family violence frameworks and therapeutic frameworks, as well as good old-fashioned case management and risk assessment. So we try to look at opportunities for safe and together and the shark cage model for family violence approach and strengths-based approach in that way, as well as our trauma-informed and family therapy practices for that therapeutic work. We usually typically work with a family, it might be between a couple of sessions or over 6 months, and we'll usually work with meet with the family in the community or at their home for up to 2 hours per fortnight.
Yeah, your program sounds great. Could you give us an idea of what outcomes you look for in this program and how they're measured?
Yeah, for sure. We have our own outcomes tool within our organisation that we developed in establishing this program, and we've taken that from some of our program logic, as well as our assessment-based tool for families, which is the North Carolina Family Assessment Scale. And we use that to identify the areas and needs for the family and scale them in terms of how they might feel that they're travelling in those areas that might have been identified as a need at the beginning of interventions and at the end. Typically, being an adolescent family violence program, we are looking for a decrease in the adolescents' use of force and violence at home, and also looking at things like increased parental capacity, better family communication, and the North Carolina assessment tool is a really great way for identifying some of those therapeutic goals. There's certain criteria around family rituals, communication and connection that really prompts a discussion about what that recovery from previous family violence by an adult perpetrator has looked like, and how the family is travelling to help really steer some of our intervention.
I imagine that there would be a number of conflicting perspectives to consider in a whole of family approach. How do you manage each family member's individual perspectives, thoughts and wishes while maintaining a whole of family approach?
Certainly, adolescent family violence does come along with a lot of conflict sometimes between parents, other siblings, and the adolescent who is at the centre of our intervention and our services. We really look at trying to build a lot of rapport with our young people to highlight their views and wishes, and use their viewpoint to also inform our assessments and our intervention planning, so that when we are looking at parental skill development, we have real life examples and conversations to draw on and use that family therapy kind of approach to have some of those conversations, typically a little bit separately. And we also look at different ways of visiting with families where appropriate. So we might have 2 people that come along for a visit where we have more complex clients. We have a number of referrals with parents who have borderline personality disorder diagnoses. And so that's been a little bit of a challenge in how their rupture and repair happens in their relationships with services and also with their family members. So we found that having 2 people along in some of those interventions has been really helpful.
You touched upon keeping the young person centered in this approach. How do you ensure that the young person's agency and voice is not lost through this approach?
Yeah, we really try and take the first few weeks of engagement with the family to build a relationship and build rapport with the young people, explain obviously the purpose of our intervention and service, and seek their views about, you know, how are they feeling that there's a service in place that's focused around their use of force and violence, and what do they have to say about that. We've been really fortunate to work with some really great young people who are really happy to talk about you know, their feelings and share that. You know, so we're really fortunate to hear that from them. There's a lot of guilt and shame about that use of violence. You know, young people are incredibly clever and insightful in linking that, you know, they can see that their use of violence can look a lot similar to violence that they have experienced, and how their family dynamic has really shifted and changed because of those experiences. So we do try to highlight that in our assessment work and also in our case planning work with families. You know, if we're talking about goals that are related to, you know, decreased use of violence, it's about asking a young person how involved or uninvolved do they feel that they can be in some of those safety plan conversations, and, you know, where's their comfortability about that, and hoping to try and increase that and having those conversations.
Following on from that, how do you make sure the whole family's voice is heard in a safe and trauma-informed way?
Yeah, I think one of the really important things we identified early on in setting up this program was how do we keep our eyes on the views and wishes and the safety of other kids in the house, who have, you know, also likely have experienced violence by an adult in their lives and are now experiencing re-traumatization, and, you know, further use of violence from an adolescent sibling. So that's really been important because we have a lot of contact with parents. So we have a lot of tools, and the assessment scales and our case planning really fits well with highlighting parental voices. And then we have the work with the adolescent. So one of the things that we thought a lot about was how do we highlight the views and the wishes and the point of view of other kids in the home's safety. So we try and do that by implementing a few things into our case planning and intake and assessment documents that are really focused specifically about the other children in the household. And what we've found is that a lot of families wish that their other children also had access to therapeutic supports. And so we've linked with some other agencies to kind of help facilitate some referral pathways so that those kids are also getting, you know, trauma recovery support.
In cases of AVITH, there's often historical family violence present. How do you address this through a whole family approach?
Absolutely. One of the underlying principles to our work is around identifying and acknowledging the use of force that the young people have previously experienced. It's probably just rooted in some social justice principles that, you know, if we're going to be working with young people who are using force, it would not be fair to them and their experiences to not acknowledge the trauma that they've experienced, and that a lot of the time this is learnt behaviour. Or, you know, and learnt norms about, you know, respect to women and how to regulate and manage emotions and trauma responses as well. So we've always kind of tried to operate from that way, as I'm sure a lot of other places do as well. And that's been really helpful for building rapport with our young people, but also then building on their understanding of their use of force and their trauma, and, you know, trying to break down some of the guilt and shame around that to get to change.
Are there any risks of collusion through this? And if so, how do you prevent that from occurring?
I think certainly we need to be worried about collusion, and I think in circumstances where we're working with other mental health professionals with young people where there might be a lack of empathy identified by mental health professionals, then that's an area that we try to be really careful with and have a lot of consultation and partnership with the mental health professionals around the young people, being that we ourselves are not mental health professionals. In regards to other collusion, I think trying to bring in other families' perspective and drawing on some of our safe and together models of, you know, the victim survivor experiences as well can really help shift that conversation to holding some accountability in that space to get to that place of change, because that's always the goal, is acknowledge the trauma, you know, acknowledge there's experiences of the young people, but also hold some accountability to come to change.
You mentioned the victim survivor experience. How do you account for victim survivors' safety and other risks during and after the program?
That's definitely brought about some challenges. We have been seeing that there's a significant need for the program, and so a number of the referrals that we received are quite high risk in terms of the severity and frequency of use of force by the young people at home, and that's definitely brought some challenges in terms of safety planning for the family. And really fortunately, some of the families that we've been able to work with have established networks, and so we're able to really work around their other children's safety with other family members, and they have a lot of support in place to help foster that. Unfortunately, sometimes when we're not seeing that, that's when tertiary services become involved, like statutory child protection and possibly hospitals and times where young people are actually spending time out of the home, whether that's in hospital stays or in out-of-home care and things like that. There is a lot of pressure for parents to manage young people in the home still, which I think is some of the themes that came out of the Royal Commission and also in the PIPA project, that mums especially are having a lack of resources and a lack of support from the sector. And I think that we're still seeing a fair bit of that. So that does bring some limitations to our safety planning, and we try to bring in some advocacy and support in situations where young people's use of force and violence in the home is actually a safety and risk factor to other people there as well. We do see that as a bit of our responsibility in that space.
Often there is a certain degree of shame from the parents when it comes to AVITH. How do you respond to this through a whole of family lens?
For sure, I think that the safe and together approach is something that we really rely heavily on in this place as well. I think that model for adult use of violence to victim survivors can really be pivoted to adolescent use of violence as well. In the same way that when things go wrong, we can see that, mum and women can often be blamed for failing to protect their children from an adult perpetrator. We can see in these instances that their parenting can also really be shamed, and that their difficulties are not being responded to with maybe as much empathy and understanding with that trauma that everybody's experienced, and really kind of been blamed on mum's mental health or mum's trauma history, that she doesn't have the skills to respond and set appropriate boundaries with an adolescent, when a lot of our families are telling us things like, they're very scared to put in these boundaries because of threats of violence and the fear that exists in their household, and need further support to manage the safety in order to do the parenting that they need to have in place. So we do really try to do that partnering work there, to highlight the strengths and the resources that are in place, but also to try and shift, not just for the family, but for the other professionals, where the focus needs to be.
Following on from that, how do you build a stronger relationship between family members rather than an environment of confrontation and blame?
Yeah, so certainly a place where this can have some challenges. We've had some success as well, which is really positive. And we can see that when those supports are put in place to manage safety at home, it really takes a lot of pressure off that relationship. When that relationship is safe and not full of violence between parents and adolescents and other siblings, the family functions a lot better. So if their supports are in place through NDIS or through funded programs in the community sector, then we can see a lot of really significant and positive change, and pathways forward for young people that are rooted in like pro-social activities, like young people who are going on to get jobs and to start work, and that those things can happen because they're no longer in that place of crisis, and that other therapeutic work to reduce violence and provide them that gendered lens can also happen and have that impact. And where we don't get that support, like, the NDIS can't fund any additional support hours, or there's no family networks for respite and no funded respite options, that's where we see that the family can kind of just roll from one crisis to the next, and safety is really hard to manage. And the confrontation between family members can just really continue and continue and continue.
How do you ensure that families build on the progress they do make from the program rather than regress?
That's certainly also really important because we are not a very long-term program, and we want to make sure that our families are set up for success and have the supports in place after we close with them. It's probably something that we build into those case management approaches and in those case plans, and identifying early on in some of those reviews, that we're at this point in the intervention, think that this is going very well, or if it's not even going well, just thinking about what are still our next steps going to be. How are we making sure that you're supported, post our closure? So some of that support has come around really organically and been fantastic about linking in other therapeutic services for other children, for women who have experienced adult perpetrated violence, and then from an adolescent to have that trauma recovery as well. And we also look at what is another case management service that might be appropriate, linking in appropriate other professionals to respond to some of those comorbidities that might be present for an adolescent. So, substance misuse, mental health, that sort of stuff. And just building some of that spaces. And if we can build those spaces early on, we can also help those other professionals understand the lens that we've applied to the family around adolescent violence, and they have those skills as well.
Moving on from that, I'd like to focus a bit more about how your program runs. Do you use multidisciplinary teams to help address AVITH?
We definitely love a multidisciplinary team. I think it's really important. A lot of the referrals and the families that have been referred to our service do have a multitude of, presenting issues that can't be managed by one referral service such as ours that's, only about 2 hours funded for 2 hours a fortnight. So we are looking at a lot of, collaboration with the disability sector. A high portion of our young people who are referred have ADHD and ASD diagnosis or suspected autism. So that's a really important part of our funding, and trying to build that professional sharing of information and skill development between those two sectors, because we know that there's quite a big divide, with disability sectors maybe not being having skills around family violence, and then family violence services not having skills around disability. So trying to build a lot of collaboration there. We've had some really great partnership and collaboration with mental health services to date, which is working really well, because a lot of the young people that also come to us with especially the higher risk of higher severity and frequency use of violence come with significant trauma backgrounds. And, certainly we're very clear that that is not a space that, our service can manage on its own. It definitely needs a multitude of other professionals in place. So that has been really positive to have outreach mental health services, like community ones, or, IMEOS and that sort of thing to help support that. We're also looking at the different ways in which we can, also partner with those agencies when we're visiting families. So having, especially families that are in a lot of crisis and who are, reaching out for a lot of support and need a lot of holding, especially parents who have their own significant trauma histories, about, when is a really coordinated approach around adult family violence services in place, mental health services, and NDIS supports, and how we share that load between us and have that informal communication by emails and sharing information outside of regular care team meetings.
How has COVID-19 affected your program and how it responds to AVITH? And how have you overcome these limitations and challenges?
Well, we pretty much started in the last round of lockdowns. So I think our program was really starting to kind of come up in about June. And then we've kind of gone through a few lockdowns and, really brief periods of not being in lockdown. So it's pretty much what we know. And I think up to 2 years almost of everyone in the sector dealing with it. I think it's something that we've all just needed to adapt to, for sure. It's not our preference in terms of needing to be distanced from young people and their families when we are meeting with them, but we certainly tried to provide community and home visits to families where it was safe to do so and where it was appropriate. And being a voluntary service, obviously, we're also really considerate of families who wanted to hit pause for a period of time for their intervention, or who wanted to, and complementing some of our work with some more virtual work. As the lockdowns kind of progressed and been in place for a number of weeks, we've seen that most of our families, are looking to that community outreach visits, and some are very happy to have us in their home, and we're just trying to balance that with what's safe for our staff and employees as well.
In closing, what are the key takeaways from using a whole of family approach? What do you think works and what do you think doesn't work?
Yeah, I think collaboration is really important. We can't hold this space on our own. And I think that there's a lot of great skills and experience that other people bring to this space when working with adolescent family violence, because it's not only a family violence issue, and certainly not how we're trying to view it. I think that we've got a really great team around us. Like, I couldn't not plug them. They're doing fantastic work. They've really responded to a very loose program design, and really tried to make it their own, and I've really got to give them credit there. I think that having some of those frameworks in place around assessment and case planning also really helps hold for our practitioners and our families what our service is, because that is a little bit hard to define as we're building it. And like, some of our families who are in a lot of crisis need a lot of supports that, as how we're funded, we're not able to provide the level of support that they're looking for. And sometimes because of the level of risk in their household, no community service agency would be able to hold. So that's been really helpful to have some additional tools with that, and the amount of training and supports that have been available to help us identify and really build that therapeutic case management space has also really been fantastic. And the response from professionals and their willingness to have us on board, and also to say when it might not be appropriate for our service to be on board with a young person if they're experiencing high degrees of stress and not able to engage with us, and really being receptive to ideas around how do we help this family and maybe lighten some other services load in terms of safety planning and that sort of thing. So I think those are things that work really well for us. I think on the flip side of service capacity that doesn't work very well is that we are only funded for 2 hours. There's not a more intensive program in our area that we can refer to for families, and there's not another step down service. So we are thinking about, in terms of our families that we are working with and the community sector, about how we ensure that that family violence lens continues after closure. And I think that in that space of managing risk at home with adolescent violence, one of the things that can get a little bit challenging is when it's not safe, what are our options? And families can feel really trapped by that, understandably, and the response in the statutory child protection space can be a little bit challenging to navigate, because the use of violence might not be viewed as a parental capacity issue, and only as a family violence issue from the young person, which doesn't give them a lot of space to intervene until parents are relinquishing, which I think sets up a really unsafe dynamic for kids and their families, and their safety at home in the meantime.
Thank you so much for taking the time to talk to us today, Scarlett. Your program sounds like it's doing some great work. You touched on some really important key issues here, and I think the one thing we can take away from this conversation today is that AVITH does not occur in isolation. Often there's a wider context that occurs, and to really acknowledge and address the violence that is occurring, you need to look at the whole of family, and I think your program is doing great work in that space. And thank you.
Thank you.
And